Thrombectomies were a total game changer in treatment of stroke. Prior to us having this procedure, if there was a very large blockage, the medicine that we used to break up the clot typically wouldn't work. And so they were stuck with no treatment. And that leads to devastating strokes. But now we can restore blood flow, give people their lives back, and we can do it right here. The patients that we see that would require a thrombectomy are the ones with something called a large vessel occlusion. And that's when a blood clot has occluded one of the big vessels in the brain. The goal of thrombectomy is to remove the blood clot. It's just that simple. And we know that if we can do that and do it in a timely fashion, then we can restore blood flow. We navigate through the blood vessels with something called the biplane imaging. And that allows us to take pictures continuously with x-rays. And then we use a little tube to go navigate through all the blood vessels all the way up to the brain. We advance that right up to the clot and then apply it to a vacuum and we just pull it up. And people who come in who aren't able to talk or they can't move one side of their body, I'll see them start to do that right away. And it's incredible. The thrombectomy program here at Mary Washington allows us to, instead of transfer patients, now we can treat patients here, which makes all the difference in the world.